Well, let's get more now. We can cross to Dr. Ahmed Elfarra, who is the head of the Paediatrics and Maternity Department at the Nasser Medical Complex in Khan Yunis in Gaza. Dr. Elfarra, thank you very much indeed for taking the time to speak to us. Ramadan has begun all over the world. It's begun there in Gaza under a fragile ceasefire. Compared to last year, is the situation any better?
First, thank you for giving me this opportunity to speak to you today. Thank you, my friend. Really, there is no big difference. I think since the ceasefire agreement, we have nearly 500 martyrs and nearly 1,006 violation of that agreement. That means that nothing different. But you know, the number of mass casualties or the number of the martyrs is less than before. But we still, in Gaza, we still in not good general condition. We still suffering. We still suffering about medical supplies. We still suffering about a lot of medication. We still suffering about the closed borders, you know, Rafah border entrance is opened, but it is opened in a decrease or a less number of evacuated cases. We are talking about 22,000 patients are waiting to be referred outside Gaza because of they need medical evacuation, and they are dealing with 30 cases, sometimes 12 cases, sometimes 10 cases. If we calculate this number, that means that we need 3 or 4 years to evacuate this number of patients. That means that all these patients, they will pass away in silence.
Okay, so clearly a very difficult time for you, a difficult time for your colleagues. I mean, how are the doctors there at the Nasser Medical Center coping after what's been more than 2 years of violence and warfare?
Really, the doctors are the main corner of the health sector. You know, my friend, what's happening is in Gaza is just not merely a humanitarian crisis. It is something affecting the human existence that belongs to human existence is the health sector. The health sector was completely collapsed during this war. We are talking about 85% of the capacity and liability of the health sector was completely destroyed. Either hospitals, primary health care, equipments, targeting doctors, arrested some of them and killed some of them. You know, doctors are working under a very difficult situation. They are, all of their families are in a tents. They are worried about their families. They are dealing with the patient in very, very difficult situation. They are working under pressure since 2.5 years. I think all of them need to be in vacation. They need to have a rest. They need to travel outside. They never know anything about rest, about vacation, about something like that. And also, there is a difficult feeling about them when they are seeing or treating the patient, and they know that they can manage him, but the patient, there is no medical supplies that can save his life. There is no medication that can help in saving his life. There is no lab results or from the lab section. There is no investigation to diagnose his case. So they feeling very, very angry because they are losing patient day by day, and every day they can deal with that case, but they don't have the equipment and medical supplies to save his life. And the patient family, the doctors is the only hope for them. They thinking that the doctor have all the solution for their patient or their young children or their adult man or woman, and they think that the doctor will save him, but the doctor have nothing because of that lack that we are talking about and because of the closed border that we are suffering from.
Right. Well, you've given us a very detailed description there of what the situation is like for your hospital, the Nasser Medical Complex. It looks as though you've got electricity at the moment. Is it reliable? Is it 24/7? And do you also have clean water inside the hospital?
Yes, electricity is a chronic headache in the hospital since the beginning of the war. Since 2 years and a half, we are talking about engines and which depend on solar fuel system, and it is working since 2 years and a half. It is not stopped. You can imagine, my friend, that electricity is coming from that engines that working 24 hours over 24 hours. In lack of the oil that we need for that engine, we lack of some a component of that engine. It is not supplied. It is not fixed in that engine. So the electricity is a miserable condition in the hospital. And unfortunately, the occupational forces, after 1 week, they not allowed for that fuel to come inside Gaza. So are we feeling a lot of worry about that? We try to cut off electricity from main parts of the hospital. And we are feeling afraid. We're asking the media, we're asking the TV, we're asking the TV channels to talk about that. We're asking the NGOs, WHO and OCHA to talk about that. After that, the occupational forces allow for a little amount to come inside, and again, it is a chronic headache. What we are looking for, that the hospitals should be covered by electricity, a constant supply of electricity, like any place in the world. I think if they allow for the fuel to come inside Gaza, to work the electricity pump of Gaza or station, I think it will cover the hospitals. The hospitals should be covered completely by that electricity. According to the water inside the hospital also depend on the electricity, because the pump that taking the water from the ground is depending completely on the electricity. So when there is a problem in the electricity, there is a problem in the water. So we are suffering of these two things from the beginning of the war.
Okay, and obviously now it's the winter, and the winter in Gaza can be a cruel winter, cold, wet. How is that affecting people there? Are you seeing an increase still in the numbers of patients coming in with ailments that are related to exposure, particular children? What's the latest there?
Yes, I feeling very upset when I'm talking about something happening in the 21st century, that children or an infant is passed away or dying due to hypothermia. Unfortunately, up till now, my friend, we recorded 11 infants who died or who passed away due to hypothermia. You know that nearly 1,300,000 people are living in a tent on the seashore in Gaza, Khan Yunis, Deir al-Balah. That tent is very weak. They are in front of the sea, sometimes in rainy weather, not warm. It is very cold. Sometimes the speed of the wind is 130 kilo, as was mentioned in the last time. Sometimes the temperature is 6 or 7 degrees centigrade. You know, my friend, that these infants are prone to hypothermia in the good house, in the concrete house, in electricity supply. They are prone to that because they have lack of energy, and they have lack of fat under their skin, and they have lack of the glycogen in their liver, and they can't shout or they can't tell that they are complaining about hypothermia. Unfortunately, 11 cases were passed away due to that hypothermia, and we are receiving every day 2 or 3 infants who are complaining from hypothermia, and they came to the hospital as soon as possible, and we try to warm them under warmer and give their medication. I want to mention, my friend, also that the delivery of the patient from that tents to the hospital is very difficult because all the roads and ways are completely distracted, and the fuel is not available. So sometimes they are coming walking, sometimes they are coming with something drawn by a donkey or a horse, and this is a very difficult situation. And you can imagine that sometimes a pregnant woman, she's in labor and in delivery, she came always on that car that drawn or pulled by a horse or a donkey, and came to the hospital. So this is unbelievable to happen in that century and this time, but this happening actually in Gaza.
And obviously, as you say, the war lasted for some 2 years, and the consequences continue. And a lot of people in Gaza haven't worked since before October the 7th, 2023. And I'm just wondering, without much cash and with limited resources, how are families managing to buy the most basic needs? How are they managing to get hold of food? Are most people still entirely dependent on aid, and is that aid sufficient?
Yes, unfortunately, they are depends on aids and donation. There is no cash available. I think this is a message that they need to take their life, their normal life. They have to return to work. They have the borders should be open and everything get inside Gaza. The raw materials, because we want to rebuild our home, our universities, our hospitals. This is will create some opportunity to work for everyone. I think this will make the economical situation is better, and this will make something to cash to be moved in Gaza. Israel is not allowed for these things to come inside Gaza. I think we're still suffering, and today the United Nations and a lot of NGOs asked for more aids to come inside Gaza. More aids to come inside Gaza. This is not the targeted that we are looking for. We are looking for something to create a new life for the civilian in Gaza to work as they used to take their opportunity for education, for receiving health services, for traveling outside, to be a human being life, not the life they are suffering from it up till now.
There are reports of a major reconstruction plan for Gaza, and President Trump of the United States has launched this Board of Peace, and they're going to meet tomorrow for the first time. What would be your message to the leaders assembled for that first meeting on Thursday?
I hope that this will happen as soon as possible, but I think that they are talking more than they are doing on the ground. We have a committee that should deal with Gaza, with her president, Dr. Ali Sha'at. The Israeli forces the occupational forces up till now, they didn't allow them to come inside Gaza to do their activities, to see the situation, to evaluate the situation. Up till now, the occupational forces is not allowed for any life to Gaza to come again or to try to create another life in Gaza, because they are thinking, and they are really about that they are thinking that this situation will enforce the Palestinian to get outside Gaza and to leave Gaza as they put in their dreams.
Okay, and just lastly, Dr. Elfarra, I mean, going back to where we started, talking about Ramadan, day one, how would you describe the mood there at your hospital amongst your patients and your staff?
This is the first day of Ramadan. Now, everyone is trying to create something looking to optimistic or looking for the future. Everyone is looking for his family, to support his family by food. Everyone is looking for again to regain his life. For example, I have two students in the university. They lost nearly 2 years of their life while they are waiting to study or to complete their computer engineering in the university. I have also another student in the Faculty of Medicine. She's just studying on media, just on phone or on iPhone or on laptop. So we are looking for again to renew or recreate our life by a normal situation that we used to deal with it before 7th of October. And really, we are feeling worried that there is a lot of promising, and a lot of promising are coming from outside, from President Donald Trump and all the leaders that carrying the peace process in Gaza, but nothing happened on the ground. At last, everything is controlled by the occupational forces. What they are decide, they do, and that feeling a lot of worry about the doctors, about everyone in the hospital, about every even teacher, even professor, even pharmacist, any category from the Palestinian people. They are feeling worry about the future because there is no true light coming from that to tell us that the future will be good and more better than is it now.
Okay, so you're saying a lot of noise, a lot of words, not enough action. We're going to have to leave it there. Really appreciate you taking the time to speak to us, Dr. Ahmed Elfarra.
Thank you.
Thank you very much indeed for taking the time to speak to us.
Most welcome, my friend. Thank you.